Welcome to The Wellness Code. Nurse Melinda from Finish First Medical is here to share a variety of medical information and solutions to enhance your health and well-being. And now to guide you through The Wellness Code, Nurse Melinda.
Well, hello, Nurse Melinda.
Hello, Michael.
How are you doing today?
Doing great. How are you?
Let me check. I'm doing good. My pulse is working.
We are still alive.
Wow, that's great. I understand that you have got some really great information to share with us today about stem cell therapy to help unlock regeneration. What can you tell us a little bit about that? So what exactly are stem cells? Why are they so special, and why do we need them?
I'm telling you, it has been a journey. I have been studying stem cells probably since 2010 when it was not kosher, I guess you could say. We'll get to that later maybe, but the ability for our stem cells to regenerate, and it started out with cloning and things like that. Are we regenerating? Or are we recreating a whole new human being? But how can we do non-invasive procedures, or because we are a reactive medicine and we want to be proactive medicine, how do we let our bodies heal themselves? Because our bodies are divine beings that are able to heal itself. So how does that work, I guess, is where the question comes from. Why stem cells? Does that make sense?
That kind of makes sense. So do stem cells kind of like run out or fall apart as we age and get older? I know I've heard stories that people will go in for stem cell therapy to get new ones or replace the old ones. Do they run out? Do they wear out? Are they like batteries? How do these things work?
Well, yeah. I mean, that's a great question because we know we age. Congratulations, right?
What?
We get older and we get wrinkles. And as we grow older and we get wrinkles and we have sun damage and we have heart damage and we have liver damage and cancer and all these things, it's because our body doesn't have the ability to fix itself. Mm-hmm. As when we're born, we have 1 in 10,000 cells. So if you really think about that, that's like we have trillions of cells in our body.
Yeah.
1 in 10,000 is a stem cell, and we're born with a specific amount of stem cells. And when we're born with those cells, they are already differentiated. I call it designated just because the farmer in me doesn't like the word differentiated. It seems so difficult.
Yeah, do the designated one. I like that better.
Designated. Yeah. So they have a home, they have a job, they have a place, and we're born with cells, stem cells that already have a home, already have a job. And as we get older, we utilize those cells, right? We fall, we break our hip. Well, now we need new bone cells. We need, new vessels and veins and things like that. And so we utilize all those cells as we get older. So by the time we're 80, depending on how hard we were at a younger age with our bodies, we're 1 in 2 million, or 1 in 200 million, or 1 in 300 million, depending on our genetics, what kind of food we've eaten, what kind of torture we caused our bodies when we were younger, what kind of lifestyle we have, what kind of environment we've been put into and chose, what kind of stress we've had. All of this thing affects our body as its cellular being. And so that's why it decreases. Does that make sense?
That does make sense. So I'm going to try to re-explain back to you what I think I heard, but I'm going to do it in a way that I can understand because I am not Nurse Melinda. So you're saying that each stem cell has a designated job and it's programmed to do that particular job. So let's say that I have a stem cell and his name is Bob. Bob's job is to take care of my liver. And Bob has a bunch of buddies that work for him. So it's like Bob is the captain and Bob goes, okay, so all you guys, we're in charge of the liver. And let's say that Bob has 1,000. There's Bob and 1,000 of his buddies. And let's say that throughout my lifetime, I'm drinking a lot of beer. I'm just really going for it. Well, Bob and his buddies, they're trying to work on my liver to keep me going, to keep me intact. But eventually, I'm drinking so much. Bob just goes, we got no more. There's no more Bobs on the team. You're on your own, Michael. And they're just gone because and I may have some other stem cells named Larry and Betty, and who's in charge of maybe my heart or my bones. They're still fine. But Bob, who's in charge of my liver, he's gone. So I'm just kind of done. Is that kind of a layman's way to understand this thing?
Yes, that's like a perfect way. Poor Bob, he's worked his butt off all his life, and now he's like, I'm done. Give me a beer too, I guess.
We're all done, and we can't use Larry because he's busy on the heart.
Because Larry has a different job.
He has a different job.
It's not his department.
Yeah, that's right. All right, so the stem cells have different departments and different jobs.
Yes.
And when we use them up, you're used up.
You're used up. So what do you do, right? Instead, now your liver is failing. So what are we going to do from the medical world? We're like, well, you have a failing liver. Well, you should have quit drinking a long time ago.
Yeah.
But I'm sure you've been told every time you went to the doctor, stop drinking. And every time you went to the doctor, you said, oh, no, I'm not. You know what I'm saying? You have those conversations because we're all humans. And we all love libations of life. That's why we're here. And we give ourselves excuses to behavior that is going to affect our bodies. But now you have normal Bobs.
Right.
Right. So now we're going to treat. This is reactive medicine. We're going to treat you and help you either get what liver you have left working with medications or help you do the liver's job with medications for the rest of your life with kind of side effects and everything else.
Yeah, I don't want to do medication. So with stem cell therapy, can I get like Bob 2.0 stuck inside me?
Okay, so now that's where it gets muddy and complicated. Bob's wearing his boots.
Yeah.
Bob's wearing his boots today. That's where it gets complicated is because this word stem cell is out in the world, and what does it really mean? What is stem cells? They had an opportunity to take blood from you, spin it down. Then they take the plasma from that blood and they take that and put that into your joints or into your muscle or whatever. The idea is they spin it and they separate the plasma, which has stem cells in it.
Okay.
And then they put it in the joint that you just tore your ACL and you need some relief from that. You're hoping repair without surgery. So you do that. It's called PRP. That has stem cells. A lot of people say, I had stem cells and it didn't work. Well, no, you had PRP. And what PRP is me taking those stem cells, those Bobs that are already used up, spinning them down, pulling them out, and putting Bob in your knee.
Oh, so Bob has a new job.
No, Bob never gets a new job. He's designated.
You designated him for my knee.
No, your body designated it when you were born.
Oh, okay.
So now you have all these cells that they're stem cells, but they're not necessarily for your knee.
Oh.
And then you put them in your knee. And yes, you can have some regeneration from that. Yes, you can have some relief from pain because we put fluid in there. And so the knee, has a cushion.
Yeah.
But eventually your knee says, wait, I just want synovial fluid in there. So it pushes it all out to the outside of the knee into the bloodstream so that it can function. And maybe you've given enough space, enough proteins, enough whatever extra in that space for that ACL to heal or, whatever your MCL, your meniscus, whatever we're trying to fix to heal in that process. And so that becomes a miracle. You did it. You fixed it with your own stem cells. You fixed it. We fixed it with your plasma.
Okay.
And some stem cells from Bob and some cells from Jen and some heart and lung and whatever.
Yeah.
So that is a stem cell therapy. Another way we could do it is pull blood from your bone marrow out of your hip. Same concept. Okay. It's your blood. We spin it down and then we can inject it into different joints, things like that. That has been the normal for years, 10 years, 15 years. That's been our stem cell therapy.
Okay.
So a lot of people go to Mexico to get stem cell therapy because in Mexico there are regulations like the United States has. But we now have labs in the United States that are monitored and and regulated to where now we can get stem cells from the umbilical cords or the placentas from brand new babies.
Okay, so I understand this can be somewhat controversial because I've heard people say that they're actually taking it from the babies, but they're not. They're taking it from the umbilical cord.
Okay, well, to clarify
that, yeah.
right? When, as a scientist, you are asked questions, always, hey, what about this? How does this work? How do we fix this? If you have a baby who has a scratch and the baby gets scratched, is healed in 3 days, doesn't scar, there's no evidence of that scratch. But then you have an 80-year-old who falls and breaks a hip and dies. Why can that baby regenerate so quickly, right? These are the questions from science, but an 80-year-old can't. And that's when they started digging into it. And the science started with embryonic stem cells. That's where the controversy comes from, is were they aborted fetuses or fetuses that died and they were being not manhandled or mishandled, but studied and discovered. Where do they get the regenerative opportunities, right? So that's where the misconception comes from, is that the stem cells we're getting or giving or have the opportunity to have come from embryonic cells, which is not true.
Okay.
That's where the science started. But now they know, wow, we could get it from the cord, or we can get it from the placenta, same cells. So a mom is pregnant, they donate their time and effort, they get tested, they have no diseases. One of the labs, I think, tests for 24 different types of viruses, things like that during the prenatal period. Then they have a C-section. The babies are born in a gentle manner, and then the cords are clamped super softly, because we also know that trauma holds in our cells, right?
Really?
So we don't want a trauma birth. We don't want a trauma at birth. So they clamp the cord. Then the cord and the placenta is then taken from the lab, or from the birth to the lab. It's called chain of custody.
Okay.
And then those cells are derived from that. So we used to think this was just byproduct delivery. We could either grind it up and eat it, or plant a tree, or throw it away.
I'm not going to grind it up or eat it.
Plenty of people do.
I've heard about the tree planting thing, but it seems to me that making use of the stem cells is a far more kinder and amazing thing to do than just throw it away or stick it under a tree or something like that. That's amazing. So I had no idea that they could do that, clamp the umbilical cord, take it from the placenta, because it's the same blood, everything is in there. It's still the same.
Right. And 10, 15 years ago, you used to have to be ABO blood typed, and I couldn't donate my stem cells to you, and because you could die and all that stuff. But now the science of it is so intricate that they separate the red blood cells, the white blood cells, they keep the stem cells, they keep all the proteins and the nutrients and everything. And so now you can utilize those cells in your body for repair right from another baby that you've never even met.
Wow. That's pretty amazing. So what are some of the benefits of receiving stem cell therapy? Like, what conditions can it treat?
Well, here's the thing, is because it's not an FDA approved product, we can't say it treats or cures anything.
Let's rephrase that. Be used for.
It's been studied. There's plenty of studies. Yeah. Every major university in the United States is studying stem cells and stem cell therapy. If you went on Indeed.com and you were interested in it, like, you would find a job in every major university in the United States.
Wow.
And so it's been studied for plenty of conditions, but the main ones that are always front of mind when I'm looking at my research are Parkinson's. Like arthritis, inflammatory diseases like arthritis, asthma, COPD, any cartilage tears, muscle tears, joint pain. And they're finding in the studies that even after surgery, you have a greater ability to recover from surgery quicker with the use of stem cells. So, but it's all the way down to autism. We really don't even know what causes autism, but they're studying autism and finding some good effects from that. So it can literally change the way we treat people reactively, but we also are looking at, is it an opportunity for somebody who's in their 40s just to get a reboot so that you're always healthy moving forward through life? Instead of saying, oh, I broke my arm, now I need them, right? Is it an opportunity for you to reboot at the age of 40, 50, 60, so that you always feel healthy? So you have all of the abilities we have to be healthy in our bodies until they're no longer alive. And we know they're going to pass away, but when, we don't know.
I'm not going.
I say I don't blame you, but there are days on this earth that I'm like, oh, I'm out.
Yeah, I'm out. It's like, oh, look at that. I think I'll stay another day.
Yeah.
So
it's like playing golf. You get one good shot and you're like, okay, I'll be back.
Yeah, I'll be back next week. Is that pie? Yeah. So I can see that this is really, really an exciting field in science. What are some of the things that just make it so exciting? Well, you know what I really want to ask you. So let's say that I'm like 85 years old, and I hurt myself, I broke my arm or something. Does it come in an age where the stem cells just are not going to be effective? Like, if I break my arm at 40 and I get the stem cell, am I going to have the same benefit when I'm 85 and have a similar condition? Or does it, once I get a certain age, good luck? Here's the remote control. Watch The Price is Right on TV.
The Price is Right. I was on that show once. That's for a different podcast. You know what? The reality is, the longer we are living with disease, our body wants to stay in homeostasis for as long as it can, right? And so as we're diseasing and as the age process diseases us, then we become homeostatic throughout life. So if it's a long-term thing or it's a chronic thing, it may take longer. It may take more cells. It may take more opportunities to be introduced to the repair agents in order for us to get the full effect of them. But acutely, it's crazy. It goes right to where it needs to go and repairs fairly quickly.
Wow.
Speaking of, now this is off topic a little bit.
Oh my gosh.
I know, off topic.
Off topic.
So my son, we talk about, does anybody even know what stem cells are? Like I do, because I'm in the world, right? And the more people you surround yourself with that know it, then it seems like everybody in the world knows what these are. But my son made me watch this show the other day, and I was just tired of TV, so he turned it on. And the girl got stabbed. She pulls the knife out of her belly and then grabs this syringe-looking thing and shoots something right in the stabbing, right?
Yeah.
And my husband goes, I wonder what that is. And I said, oh, I know. It's stem cells. I just
really
being like, oh, I know. Like I didn't know, but I was like, just because that's my world. And then the next scene, another guy got hurt and yelled, give me the stem pack. Give me the stem pack.
Oh my gosh.
And it was the syringe. So, I mean, if it's in the movies, right, then it's got to be real.
Well, they tell us everything that's going on in the movie, so it's probably happening. So are there any other risks or even ethical concerns? But let's start with risks to stem cell therapy. Okay, I'm 85. I broke my arm. I need stem cells or whatever. What risks do I have?
There are several risks when it comes just to the procedure itself, right? If we're injecting in a joint because you have knee pain, or if we give it to you IM, or if we give it to you IV, it depends on your preference of administration. The risks always there are of infection. Anytime you break the skin, you have the risk of infection. But the biggest risk would be, we think, are we going to have a reaction to the cells? Mm-hmm. We're finding that there is minimal risk to the cells. If you have a reaction to any of the cells or to the components, the diluent agents that are inside the little container, it would be a rash. But we always have emergency kits just in case. Mm-hmm. Now, here's the saddest part about it all is you have got to find providers who are using quality product, because we have, I kid you not, I was looking on Facebook on an ad and somebody said, I make my own stem cells in my garage.
Really? They were on eBay or something?
I don't know.
Oh my
but
gosh.
let's not go by
No.
the guy that's giving Bob's liver, you
Yeah.
know, stuff out of the garage. Let's find and vet the providers that are doing it from labs that are approved, and let's do it in an environment that is healthy, right?
Yeah.
So when we have our therapies, sometimes, most of the time I do them at my clinic, but if I've got somebody who is wheelchair bound or bed bound or whatever, we'll go to their home. But it's as sterile as we can be. I always have an assistant with me so that the product is thawed and then ready right there to where nobody has to like manhandle it. And you know what I'm saying? It's in the administration procedure is where you're going to get infection. But it's also if you go to the cheapest person, because if you can imagine this technology isn't cheap.
Yeah.
We're taking cells from a cord blood. But if you go to somebody that says, I'll give it to you for $500, where are you getting it? Let's make sure you're getting quality product, the product that is actually advertised and marketed and what you're paying for.
Yeah.
Because everybody will take advantage of an opportunity if they can.
Yeah. Well, you know, that makes a lot of sense. I can see where people would try to save money, you know, so to save a few bucks. You know, I had a friend that went to Dr. Wally's used car lot and stem cell discount store. And things are going great with him. You know, I could see that eventually.
Yeah.
you
Yeah.
know. Yeah, let's get some discount stem cells and just kind of stay. That's like going to the discount plastic surgeon. Okay, my nose is over here now, but I can breathe better.
But I can breathe better.
Yeah.
I know. And it's sad. It's sad because you want to trust everybody, right? You want to trust everybody that's come to you, but really vet them. We shop harder for a TV than we shop for our medical care.
Wow, that's kind of terrifying, isn't it?
It's sad.
Yeah.
It's sad. My dad died because of blind faith, and I wish he would have just asked more questions. Just ask more questions.
Mm-hmm.
Ask for proof. Show me where you get your cells. Show me where it comes from. Give me something. So I'm all about that. I'm all about providing, quality medical care at an affordable price, but at the same time, ask me questions. I will never be offended if you say, prove to me where you get it or prove to me how to be there.
Wow. So any last minute words of wisdom pertaining to stem cell research?
Just know, there are different opportunities, even if people go to Mexico, same thing. Ask about the product, ask for the science. Don't just go in there blindly thinking that you're doing what, Joan did across the street. Make sure you shop your provider very well and understand. And the reality of this, everything that's coming forward with new medicine and new treatments is you, the consumer, are in control. If you decide you're doing stem cell therapy, then you're taking the risk.
Yeah.
So know what your risks are.
Well, this was a really interesting topic. And I think we may have to do a part 2 of this topic. This is really, really good. So in the meantime, thank you so much, Nurse Melinda, for joining us today. And
Thank
we
you.
look forward to seeing you again soon
Thanks.
with another exciting edition of The Wellness Code.
The Wellness Code.
See you guys.
You've been listening to The Wellness Code with Nurse Melinda from Finish First Medical in St. George. For more information, finishfirstmedical.com. Please like, subscribe, and share. And we'll see you next time on The Wellness Code with Nurse Melinda.